Dynamic stretching is like when you go to a birthday party. What do they do to that clown? Well, the clown. What do they do? They probably throw them out. What do they do to the balloon before they stretch it? Right, they go back and forth. Okay, just like that. All right. So now I need you. All right. So this is what you're gonna do. You're gonna go down to one side 10 times. It doesn't matter how far you stretch. I don't care if you go like this and then you tighten just 10 times. Dynamic. 1, 2, 3, and all you should be doing is just feeling your hamstring just stretch, relax, stretch, relax, stretch, relax. And do that, what's it, 10 times. Okay, cool. Let's go the other way. This way. 2, 3, 4. Does everybody feel their hamstring stretching? Okay. You feel your back? Well, that's the thing, too, is a lot of times what happens is, especially in American society, when everything's about money, if your back hurts, what do the doctors tell you? Anti-inflammatories, muscle relaxers, let's do exploratory surgery. What does that mean? We give you anesthesia, we knock you out, we slice you open, we try to figure out what's going on. But then I'll go and work with somebody who's about to go into surgery, and we just stretch out their hamstrings and their butt cheeks for like 2 weeks, and their back pain just goes away, and doctors go away.